Hello, my name is Shamaya, and I'm going to be working with you today. So first I'll just start off by asking you a few questions about your history, okay? So when did the swelling begin?
Actually, I was around 10 years old when I first saw swelling.
Okay. Did your swelling begin quickly or slowly?
Well, at the beginning, it developed quickly.
Quickly? Okay.
Yeah.
What have you tried to treat your edema? Like, have you used any compression garments?
Yeah, I actually use compression garments a lot, but they're kind of hard to put on, take off and put on.
Okay. Do you have anyone at home that can help you with your compression garments?
Yeah, my husband.
Okay. Have you had any skin infections?
Yeah, I had something called cellulitis infections before.
Cellulitis, okay. All right, so based on your medical history, what I see is that you've had the cellulitis infections, you also had hypertension, and you have a BMI of 35, which puts you in the category of being obese. So with the cellulitis infections, because you've had those infections before, they impaired your immune system, which has delayed your wound healing process. Also, because you have hypertension, that can also decrease the amount of blood flow getting to your tissue, which can also delay your wound healing process. And because you've had a BMI of 35, that does put you in the category of being obese, and obesity does limit the oxygen supply to your tissues, which will limit circulation and so forth. So that has also contributed to your wounds and why they haven't really been healing. So I also see that you're on a couple of medications. You're on lisinopril, which treats high blood pressure. You're on hydrochlorothiazide, which also treats high blood pressure, and it's good for fluid retention. So lisinopril and hypochlorothiazide, let me make sure I can pronounce that right.
That's a hard one.
So it may contribute to delayed wound healing as well. So we want to watch out for those medications. I also see here that you are a full-time automobile mechanic. So I'm assuming that your job requires you to stand for long periods of time, which can also delay your wound healing too, because you're in a dependent position for a long amount of time. You're not getting a lot of circulation going. So we just want to watch out for that. You also haven't really been consistently using your compression garments over the years. So that has prolonged your wound healing process as well. And we just want to make sure that you can maintain a healthy weight too, because I know that you've been dealing with some weight issues, and that has been contributing to some wound healing issues that you have. So the next thing that I'm going to try with you is I'm going to run a systems review, and I'm basically just going to test the different systems of your body. So the first system that we're going to test is the cardiovascular system. So I'm going to take your pedal pulse. So the way that I'm going to do this is, you can come a little bit closer. So I'm going to bring my fingers on the dorsum of your foot, and I'm going to just check your pedal pulse, okay? Now a normal result would be a 2+, which is normal and steady, and an abnormal result would be diminished or an absent pulse, so I wouldn't be able to feel anything. Now I know that you're on medications like lisinopril, so that can also contribute to decrease in blood flow. So it's a little bit decreased, but I can still feel the pulse. So the next test that I'm going to try is called the Stemmer sign. So for the Stemmer sign, I'm going to just pinch the top of your toe, and if the top of your toe is able to tent, then that means that the Stemmer sign is negative. If the top of your toe is not able to tent, then that means that it's a positive Stemmer sign. So I'm going to just pinch the top of your toe here. Okay. So I'm going to just document my findings here. So it seems like you have a positive Stemmer sign, because I was not able to pinch the top of your toe. It wasn't able to tent. So it's a positive Stemmer sign. Now I'm going to check your pulmonary system. So this is just me checking you breathing. For musculoskeletal systems, we're going to just check range of motion, manual muscle testing. For the neuromuscular system, we're going to just check the sensation, balance, make sure everything is okay with that. Do you have any GI issues? No?
No, not really.
Any urinary incontinence? No? Okay, so we'll make note of that. Okay, so now we're gonna look at the wound. So we're gonna come over here. So the location of the wound is, there's one wound above the lateral malleolus, and there's another one on the lateral aspect of the calf. So the first wound that we're gonna measure is the one on the lateral malleolus. You can come a little bit closer. So we're gonna just measure this from 12 o'clock to 6 o'clock. Okay, so I got about 4 centimeters of length, and then for the width, I got about, let's see, 1 centimeter. Okay, so that's 4 centimeters squared for the one at the lateral malleolus. And now we're going to measure the one on the lateral aspect of the calf. So this one here, we're gonna go from 12 o'clock to 6 o'clock. This is about 3.5. And now we're going to do the width. Okay, this is about 1.5. So 3.5 times 1.5. So this is about 5.25 centimeters squared for the measurements. And now we're gonna just look at the percentages. So the percentages for this one here, down here at the lateral malleolus. So we're gonna cut this in about 50%, half of 50%, 25%. Half of that would be 12.5. We see a little bit of S-scar here, so 12.5% plus 12.5%. So we're gonna say 25% of S-scar and about 75% of granular tissue here. And then over here you can see the granular tissue and some of that S-scar, so we're just gonna take the percentages, about 50%. If we cut it in half here, 25%, half of 25%, 12.5, 12.5, 12.5. So we're gonna say about 25% S-scar and 75% granular tissue on the lateral aspect of the calf as well. So if you look at the wound edges have black S-scar, the edges are uneven, and there's some hyperkeratosis around the edges. For the peri wound, we see that the skin is firm, fibrotic, the edema is hard, and the skin has hyperkeratosis. And the wound, the amount of exudate is heavy, and the type of wound exudate that you have is lymphoria. Okay, so based on all these findings, I'm gonna say that you have stage 3 lymphedema with venous ulcerations. So the way that we wanna treat this, I can bring it back up here. So the way that we wanna treat this wound is that we will debride some of the black S-scar and callus with sharp debridement, and we will also use an autolytic debridement as well. So I will be introducing you to that treatment a little bit later on. And for the wound itself, we will be using a calcium alginate for our primary dressing, and we will also be using a woven gauze wrap as our secondary dressing. So the reason why we're going to use the alginate is because it's good at absorbing moderate to heavy wound exudate, which you have a lot of wound exudate, a lot of fluid coming out of your wound. So we want to make sure and absorb all that fluid with the alginate. I'm also thinking about putting a honey impregnated dressing on your wound because it will reduce inflammation and edema, and it will also reduce the risk of you acquiring infections because it's an antimicrobial. Okay, and then we'll put the woven gauze around it as our secondary dressing. It will help pick up any extra fluid that we have. It will also help secure the alginate in place and the dressing in place. So then after that, I just want to bring up a few things for you. So since you've had issues with putting on your compression garment, I would recommend that you use a bandage alternative, such as Cercade or Medisys, because it's a little bit easier to use. You can wear it at night. It's also for aggressive lymphedema, which you do have, so that will help get it under control. I want you to replace the bandages every 6 months. I want to make sure that you're wearing the bandage at night, and make sure to wear it daily, okay? Make sure to wash the bandage after every use. We want to keep it clean, and make sure to moisturize your skin with a low pH hypoallergenic lotion to reduce the risk of acquiring infection. So some of the challenges that you might face is that because your lymphedema is severe, you may be at risk for increased risk of acquiring infections, okay? So therefore, it's important for you to wash your skin daily, moisturize it, because that's going to help keep the bacteria out. So just try to keep your skin clean, okay? Moving forward, I would also like to see you be a part of a cardiovascular exercise program, because that's going to help stimulate your lymphatic fluid, and it's going to just improve your overall condition. And I also want you to try breathing from your diaphragm, because that can also help stimulate lymphatic flow and help keep the fluid moving within your body, okay? So those are just a couple things I want you to do moving forward. It was nice meeting you today, and have a great day.